Assalamu alaikum and welcome to Health is Wealth. Today we will be discussing how to monitor and manage your diabetes. With us in the studio today we have Juliet O'Brien from Diabetes UK. Welcome to the show, Juliet, and thanks for joining us today.
Thanks.
So Juliet, diabetes is highly prevalent in the UK and it's quite common amongst the Muslim population as well. Do you have any facts or figures that you can share with us?
Yes, we know that in England and Wales there's 2.7 million Muslims, and out of those, about 325,000 is estimated to have diabetes, so it's pretty high.
That's very high. And is there any value in actually monitoring diabetes?
Yeah, it's vital really, because people with diabetes can be at risk of serious complications. It shouldn't be taken lightly. The complications they could be at risk of could be they could lose their eyesight, they could be at risk of amputation, they could also be at risk of kidney disease, stroke, heart disease, so it affects all different parts of the body. So people should really make sure they take their medication and also do regular physical activity and look at their diet, healthy eating, and if they need to be referred to a dietitian to get that advice about how they should manage their diabetes and avoid those complications.
Well, absolutely, it's very important because the complications you mentioned, they're life-changing complications. So yeah, it's very important. How can patients manage their diabetes in the comfort of their own home?
Well, a patient with diabetes, they'll probably only see their healthcare professional probably about 3 hours a year in total. It's pretty minimal.
As little as that?
That's right, yes. So really it's all about self-management. So what we would advise, if they have locally, if they're offered an education course such as Desmond or Expert Patient, so for people with diabetes, those are courses offered by the NHS. They should really take that up because it gives them vital information about how to best self-manage. They need to check their blood glucose regularly, really important, so they're aware how they're managing their diabetes, and take their medication and attend the GP when they go to the appointments. And also they need to make sure that they get all their regular checks on their eyes, their feet, so that they know that everything's okay, and if not, referred to a specialist.
Okay, so hypoglycemia is quite a common side effect of most anti-diabetic drugs. How do you cope with hypoglycemia? So how would a patient know, firstly, if they are having a hypoglycemic attack, and if they are, what should they do?
Usually there would be signs, so they might be shaking, they might go pale, might be a bit sweaty, so they might be aware that they're about to have a hypo. So how they need to treat that is that if they have some glucose tablets with them, or otherwise a can of Coke, something to bring them back up again, because what's happened is the blood sugar's gone down, they need to be brought back up again, and then follow that by a sandwich. But also they should let people around them know that they have diabetes, so that if they don't notice it themselves, somebody else will, and say you might be having a hypo, and give them the help that they need.
Okay, that's very sound advice there. And right now we're observing Ramadan. Patients who suffer with diabetes, can they actually monitor their blood glucose whilst fasting?
Yes, I mean, some people are under the misconception that this is breaking the fast, but that's not true because you're drawing blood out of the body, you're not putting something in. And in fact, it's really important, especially these long days. People could be at risk of hypos, hypers, or dehydration, so they should really check their blood glucose at regular intervals to check nothing like that's happening.
So do you have any diet tips for patients suffering with diabetes, especially now during Ramadan?
Yes, people should break their fast with healthy food, so it might be with fruit, that's quite traditional to break it with grapes or dates. But also to have food that's long lasting, so carbohydrates such as whole grain rice, whole grain bread, maybe a bit of meat with the fat trimmed off, but something that should last throughout the day. And also plenty of water, because in these long days dehydration is a big issue.
Oh, absolutely. And what about after, once fasting is over? Is there any sort of diet regime that patients suffering with diabetes should be following?
Yeah, I mean, it's similar foods really, just foods that will last you for a long time, and so that it would be less at risk of having a hypo or hyper. So it's the long-acting kind of carbohydrate type of foods, but also looking at portion size, not overeating, especially at night time, because that could be a risk of hypo.
Are there any fruits? Because I know usually, we say, 5 pieces of fruit or veg a day, but are there any fruits patients with diabetes should be avoiding?
We don't say that anything is out of bounds, but there are certain fruits which do have a higher amount of sugar, such as grapes, such as mango. So maybe a third of a mango, maybe just a few grapes, because they have a higher amount of sugar, natural sugar, than other types of fruit.
So the key really is portion control.
Exactly.
And
yes,
just monitoring what you're eating and eat a bit of, have a balanced meal. So where can our patients suffering with diabetes go for further information?
We have a website, it's diabetes.org.uk /Ramadan. So we have a particular information about fact sheets and about Ramadan and
that's
diabetes.
Fantastic. Brilliant.
Available in English, in Urdu, Arabic and Bengali.
Oh, that's brilliant. That's fantastic. Thank you very much for joining us today, Juliet, and providing all the valuable information.
Thank you.
Diabetes is highly prevalent amongst the Muslim population in the UK. If you suffer with diabetes, it's important that you monitor and manage your diabetes effectively. If you'd like any further information, please visit diabetes.co.uk or see your pharmacist or your GP. We hope you enjoyed the show today. Now it's time for our fitness segment with our personal trainer. Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's very normal during Ramadan to feel very low of energy. That's not so much because you're not eating, it's more because you're dehydrated, you're not getting enough to drink, and especially when the days are really, really hot. Now, if you're sitting in an office and you're feeling low of energy, there are some simple stretches you can do to get a little boost of energy during those days. I'm going to show you 3 of them today. The first one is very simple, stretching the neck. So you're just gonna lean your head to one side and gently pull it down towards your shoulder and relax the opposite shoulder as much as you can. Hold the stretch there for about 30 seconds and release and do it again on the other side. The second stretch is for your pecs and for your thoracic spine. So the first one starts off with stretching of the upper back, the thoracic spine. You push as far out as you can. You may even want to change hands and pull the other arm as well out a little bit. The next one is for your pec, and you simply stretch your arms as far back behind you as possible until you feel the stretch. These stretches you should hold for about 30 seconds each, both ways. The last one I'm going to show you is just for a rotation of the spine, to keep your spine moving so it won't stiffen up. You use your chair, your office chair, and you hold as you try and rotate your body backwards. Now, some may be more flexible than others. Go to where you're comfortable and do it on the other side. All of these stretches can be done at your desk. You don't have to leave and you don't have to stop your work. You just do it for 2 minutes and you're done.